So now we're going to be talking about muscles of the thigh. The first muscle I want to talk to you about is this muscle that crosses over from the lateral to the medial. This is the Sartorius. The Sartorius originates on the iliac spine, and it's going to insert on the or close to the tibial tuberosity, and therefore it's going to cause flexion at the knee, and it's also going to cause abduction, ABD, flexion and lateral rotation at the hip. Then I'll go to this other muscle here, which is very medial, which is the gracilis. The gracilis is going to originate on the pubis. It's going to insert on the medial surface of the tibia, inferior to the medial condyle, and therefore it's going to have a function of flexion and medial rotation at the knee, and also adduction and medial rotation at the hip, so ADD. And I sometimes get these two confused, the gracilis and the sartorius. So for me not to get confused, I remember that sartorius starts with an S, so it starts on one side and goes to the other side, so side, side for S. And the gracilis starts with a G, so it's located closer to the groin. So if you can use that to help you, go right ahead. So now we're going to remove the sartorius, so we can see the muscles that are underneath. Let's start with this big, huge muscle over here. It's called the adductor longus. Now the adductor longus is going to originate on the pubis, and it's going to insert in the linea aspera of the femur. So it's going to insert on the posterior side of the femur, and therefore it's going to cause adduction, flexion, and medial rotation at the hip. Remember that muscles that flex the leg, they are located on the posterior side, and muscles that extend the leg are located on the anterior side. So it's different from the upper limb, so keep that in mind. The next muscle is the Adductor Magnus, which is this muscle over here. So it starts over here, and you can see it right over here on the back. And this is going to originate on the pubis also, and it's also going to insert on the linea aspera of the femur. The whole muscle is going to produce adduction at the hip. More anterior, we have this muscle here that's called the Iliopsoas. The Iliopsoas is when it's formed by the union of the iliacus and the psoas major. The iliacus, as we know, originates in the iliac fossa. Psoas major originates in the vertebrae, more specifically T12 to L5, and therefore they fuse to form what we call the iliopsoas. They're going to insert in the lesser trochanter of the femur, and together they're going to cause flexion at hip and or lumbar intervertebral joints. So this little tiny muscle that you see right over here. The next muscles that we're going to talk about are what we call the Quadriceps Femoris, or just quadriceps muscles, that are these big muscles located here anteriorly. We have what we call the Rectus Femoris, which is the one very medial. You can see that it's pretty big. It's going to originate in the iliac spine and superior acetabular rim of the ilium, and it's going to insert in the tibial tuberosity. The next one is on the lateral part, which is called the Vastus Lateralis, and you can see it here, and it goes all the way to the back. So all of this beneath the iliotibial tract is also the Vastus Lateralis. The next one is the Vastus Medialis. So like the name says, it's going to be in more medial. So this is the Vastus Medialis. Now the Vastus Lateralis is going to be going to originate close to the greater trochanter and along the linea aspera, and it's going to insert in the tibial tuberosity, so it crosses the knee joint. The vastus medialis is going to originate in the entire length of the linea aspera and also insert in the tibial tuberosity. So to summarize, I know I said we have 4 quadriceps femoris. There's a fourth one that we can't really see that's below the rectus femoris. That's called the vastus intermedius. So we can't see that muscle here. All of them that we've mentioned, so the vastus lateralis, the vastus medialis, and the rectus femoris, all of them are going to insert in the tibial tuberosity. So because they insert in the tibial tuberosity, they cross the knee, so they're going to cause extension at the knee. And besides that, the rectus femoris will also serve to flex at the hip because it originates further up in the iliac spine. The last few muscles that we need to talk about, they're going to be located posteriorly, and these are known as the hamstrings. We have 3 of them. First one is what we call the biceps femoris. So like the name says, biceps means it's going to have 2 heads, and you can't really see it over here, but if you remove this muscle, you're going to see the other head of the biceps femoris right over here. So the biceps femoris is going to originate in the ischiotuberosity and linea aspera of the femur, and it's going to insert in the head of the fibula and the lateral condyle of the tibia. Now the semitendinosus, which is this muscle right over here, so it's going to be next to the biceps femoris. Semitendinosus is going to originate in the ischiotuberosity and insert in the proximal and medial surface of the tibia. And right over here you can see a little bit of the semimembranosus right over here, which is also part of the hamstring. And this muscle is also going to originate in the ischiotuberosity, but it will insert on the medial tibial condyle. Now all these hamstrings, they're going to cause flexion at the knee, and they're going to also cause extension and medial rotation at the hip. So a lot of times you guys get confused between the semimembranosus, which is this little tiny muscle over here, and the semitendinosus. So one thing that is helpful for me to remember is that the semimembranosus is between the semitendinosus and the biceps femoris. So what makes me remember is that I think of the interosseous membrane of, let's say, between the ulna and the radius. And so interosseous membrane, therefore this is the semimembranosus. So therefore the other one will be the semitendinosus. And it's important to also bring up that the semimembranosus also comes on the other side, but it's easier for you to see it here squished between the biceps femoris and the semitendinosus.